Let's get started. Hi, my name is Ratcha Raksakmanut, PhD student from Chulalongkorn University, Thailand. Today, I would like to present some highlights from our project, the potential microbial biomarkers for caries prediction in 1-year-old children. Dental caries in children causes many negative health and economic issues that impact the well-being of children. And the caries prevalence is increased rapidly at the early age. To reduce its prevalence, we should provide a preventive intervention within the first year of life. The problem is we cannot provide the best prevention to every single child. So it should be targeted to the high-risk group using caries prediction. Unfortunately, the most powerful predictor that we have right now is the past caries experience. And that is not practical for 1-year-old children, that most of them might never have caries before. So we need another predictor that is specific for 1-year-old children. Oral microbiome is a promising candidate for caries prediction because dental caries occur due to the long process of the imbalance in the oral microbiome. And at each stage of caries, they consist of the different microbial members. If we can find that differences before the caries onset, that could be a predictor for future caries. So the objective of our study was to identify the microbial biomarkers that could be used as a caries predictor in caries-free 1-year-old children. From our previous big cohort study, we used a nested case control design by selecting only the caries-free 1-year-old children who developed caries differently at 2 years old. The first group was the children who remain caries-free. Second, who developed only white spot or non-cavitated lesions. And lastly, who developed decay or cavitated lesions. We used the saliva at 1 year old, that all of them still be caries-free, and used the 16S sequencing to analyze the microbiome. First, looking for differences using diversity analysis, and then perform the biomarker discovery. For diversity between groups, we found the different microbial structures between the children who remain caries-free and those who develop cavitated lesions. And next, after assigning the taxonomy, we couldn't find any significant difference at the genus level, so we further finding the biomarkers at the species level. And because of the different microbiomes that we found in the previous analysis, we showed the differences between the children who remain caries-free and who develop cavitated lesions for the further analysis. First, we analyzed the differential abundance of each species and found that 4 species were significantly different in relative abundance. 2 species of Prevotella, 1 species of Leptotrachea, and Campylobacter contagious. And all of these species were found higher in the children who remain caries-free. And to confirm that finding, we used another approach to identify the biomarkers using LabC, which showed a consistent result that the same 4 species were identified as biomarkers for the children who remain caries-free, suggests that these 4 species are the potential predictor that the higher abundance of these species is related to the low risk of having caries. On the other hand, the lower abundance is related to the high risk of having caries. And these changes could be observed long before the caries onset. In this case, is up to 1 year. And okay, there has been only 3 longitudinal studies that use the oral microbiome to develop the caries prediction models. These 2 studies construct the model based on the differences between caries-free and caries-active microbiomes to define the high-risk group. This approach is different from our study because we analyze only the caries-free children who develop caries differently in the future, which is a more direct approach to interpret for the predictor in caries-free children. And more than that, they're studied in 3 and 4 years old, and that might be too late for the caries control strategy if we want to reduce the overall prevalence. Another study from last year used only caries free to solve this problem, but anyway, the target group vary from 1 to 3 years old. And because 1-year-old children have a different microbiome compared with the other ages, so in our study, we analyzed only 1-year-old children, which should give a more specific result for this target group. In conclusion, we analyzed the saliva from caries-free 1-year-old children and could identify the biomarkers that the low abundance is associated with the high risk of having caries. From this, it could be developed into a saliva test kit that would help the targeted prevention to precisely predict the 1-year-old children who have a high risk of caries. So we could provide the prevention with more efficiency, and hopefully the decrease in caries prevalence could be possible. Thank you for your attention. I would like to thank you, my group and the lab facility, and any question is very welcome.